This lesson plan will be regarding the knee. In this lesson, we will discuss the knee, the anatomy of the knee, common injuries that occur in the knee. We will learn some special tests and also some tape jobs that we can do for the knee. The goal of this assignment is to gain an understanding about the knee joint and all its components. Before we start learning about the knee, I'd like to start this lecture with a little inspirational speeches video. Thank you.
Great moments are born from great opportunity.
You shouldn't have any doubt in your mind about what you're supposed to do tonight and about how you're supposed to do it.
This is your time.
No, I don't want them to gain another yard.
We gotta go out there and we gotta take it.
You take their game and you shove it right back in their face.
That's how winning is done.
Team is something you belong to, something you feel, something you have to earn.
If we don't come together,
It's over.
And I guarantee you, a week won't go by in your life you won't regret walking out, letting them get the best of it.
I'll ask you one last time.
To be the best that you can be.
play like champions.
Win.
It's about heart. It's about who can go out there and play the hardest.
It's about how hard you can get hit and keep moving forward.
I don't care what the scoreboard says at the end of the game. In my book, we're going to be winners.
In any fight, it's the guy who's willing to die,
Willing to take the hits.
who's gonna win that inch.
Let me tell you something you don't let
Nothing come between us.
On this team, we fight.
And we shut them down because we can.
Here are the definitions of some frequently used terms throughout this lesson. Anterior means in front. Posterior, in back. Medial, closer to the midline of the body. Lateral, farthest from the midline. Ligament, structure that connects bone to bone. Meniscus, fibrous cartilage between surfaces of a joint. Supine, lying on your back. The knee joint is comprised of 4 bones: the femur, the tibia, the fibula, and the patella. As you can see through the image shown, there's a front view, side view, and a back view. The femur is the longest bone in the body. It is also one of the strongest bones. It's the bone that sits on the superior aspect of the knee. And then below you have the tibia. That is one of the bigger bones of the lower leg, and alongside it you have the fibula, and then the kneecap just sitting in front of the femur and the tibia. This bone is called the patella. The ligaments and menisci of the knee. The knee is made up of 4 major ligaments: the anterior cruciate ligament, or ACL, the posterior cruciate ligament, or PCL, the medial collateral ligament, or MCL, the lateral collateral ligament, or LCL. There are also 2 cartilaginous structures called meniscus, or menisci for plural, the lateral meniscus and the medial meniscus. As you can see through the image, the anterior cruciate ligament starts at the posterior end of the femur and ends at the anterior aspect of the tibia. This ligament prevents anterior translation of the tibia along the femur. The posterior cruciate ligament starts in the anterior aspect of the femur and ends in the posterior aspect of the tibia. This ligament prevents posterior translation of the tibia along the femur. And then on the outer side, we have the lateral collateral ligament, which starts in the lateral condyle of the femur and attaches to the head of the fibula. This ligament prevents varus force along the knee. Then we have the medial collateral ligament, which is on the inside of the knee. This one starts in the medial condyle of the femur, and it ends on the tibia. This ligament prevents valgus force along the knee. And then we have the lateral meniscus and the medial meniscus on the inside. So the meniscus are cartilaginous structures that provide more support to. They work as shock absorbers and give a little bit more stability to the knee. Because as you can see, the femur and the tibia don't sit perfectly together. The shapes of the bones cause them to sit awkwardly, and these ligaments help provide, extra cushion and extra support to the knee. The muscles of the knee. You'll find two major muscle groups in the knee. These muscle groups are the quadriceps and the hamstrings. The quadriceps group is made up of the rectus femoris, the vastus medialis, the vastus lateralis, and the vastus intermedius. The rectus femoris is the largest muscle in the quadriceps group. The vastus medialis sits on the medial aspect of the group. The vastus lateralis sits on the lateral aspect of the group, and the vastus intermedius sits in between both of these muscles. This muscle is located directly underneath the rectus femoris. Also, you have the hamstrings group. The biceps femoris, the semitendinosus, and the semimembranosus comprise this group of muscles. In this photo right here, you see that the highlighted areas are the hamstrings and the quadriceps group. The hamstrings being located on the posterior aspect of the body and the quadriceps on the anterior aspect of the body. In this image here, you have a better idea of what the muscles look like. The semimembranosus muscle is located on the most medial portion of the posterior leg, and then it is followed by the semitendinosus muscle, and then you have the biceps femoris muscle, which is on the most lateral aspect of the leg. And then we have a picture of the quadriceps group. The rectus femoris, like I said, is the largest muscle in the quadriceps group, and it is located in the center. This also makes up the patellar tendon. And then we have the vastus lateralis, which is on the lateral side of the leg, and then the vastus medialis muscle, which is on the medial aspect of the leg. And you can't see it in this image here, but the vastus intermedius sits just underneath that rectus femoris muscle. In the next part of this lecture, we will be discussing some of the injuries that occur to the knee. Primarily, we will be focusing on the ACL injury because it is the most common injury that occurs in the knee. So the ACL injury is also known as a sprain, and a sprain is an injury to a ligament. There are four common mechanisms of injury. The first being anterior displacement of the tibia relative to the femur. So when the tibia is driven forward along that femur, and then the femur being driven posteriorly on the tibia. So if you have forces pushing that femur back, this can cause injury. Also, non-contact torsional stress when the foot is planted and the body keeps rotating. And then also hyperextension of the knee, so an overextensive force on the knee. The most common mechanism of injury of these four is the non-contact rotational stresses of the knee. You may hear the athlete complaining of hearing a pop in the knee, and they will experience immediate loss of function. They'll try to get up and they won't be able to. In this video here, we are going to see the most common mechanism of injury to the ACL. So briefly, they're just going over the movement of the knee and the natural movement of the knee. And they give a breakdown, so see, they even break it down to show you to isolate specifically that ACL and how it moves and the job it's supposed to perform. So the knee moves normally like that, it bends, and that ACL prevents forward movement of that tibia. So here the athlete is running, and then you see that their foot is planted and their body keeps moving. And here's an example with an NFL player of how the foot stays planted into the grass or the turf. So the foot is planted and the body keeps moving, and this rotational force causes injury to the ACL, and you can see there the twist and snap. And like I said, the athlete will complain of hearing a loud pop in the knee. Most of the time this injury requires surgical intervention if they'd like to continue playing competitively. There are many predisposing factors that cause ACL injuries. There are both extrinsic and intrinsic factors. Some of the extrinsic factors are sport-specific body motions, such as landing from a jump or sidestep cutting movements, muscle strength or fatigue, anterior pelvic tilt, introverted femur, a wide pelvis to femoral length ratio, menstrual cycle, and females are all extrinsic factors as to ACL injuries. Some of the intrinsic factors that cause ACL injuries are joint laxity, small size of the ACL, genu recurvatum, which is hyperextension of the knee that causes posterior bowing, and narrow intercondylar notch width. In this next section, I will be discussing some of the special tests used to determine ACL injury, and also a tape job that can be used to provide a little bit of extra support to the ACL. While this tape job doesn't prevent ACL injuries, it is good to use for a little bit of support and more knee stability. So the first test is the Lachman's test. You have your athlete lie supine, and you passively flex their knee to 20 to 25 degrees. You place one hand on the tibia holding the tibial tuberosity, while the other hand holds the femur just above the patella for stabilization. And you take your hand holding the tibia and you pull it forward. A positive finding for this test would be increased anterior tibial translation. This test is the more effective test used to determine ACL tears. The next test is the anterior drawer test, and again you have your athlete lie supine, have them flex their hip to 45 degrees and flex their knee to 90 degrees. Sitting on the table, you face the athlete's injured knee and place both thumbs along the joint line. You take your index fingers and palpate the tendons to ensure they are relaxed, and you proceed to pull the tibia forward. Again, a positive finding for this test would be increased anterior tibial translation. And also you'll find with both of these tests that the athlete might be a little bit apprehensive and they might tighten up those hamstrings, guarding because they don't want to feel that pain. And here are a couple of pictures of what the tests should look like and a little bit more on the hand placement. So first we have the Lachman's test here, and next we have the anterior drawer test here. And I will be showing videos on how to demonstrate these tests properly. So this test is the Lachman's test. This test tests the integrity of the ACL ligament. The ACL ligament starts at the front end of the tibia and ends in the back of the femur, and what it prevents is that anterior movement of the tibia along the femur. So you want to take the knee, make sure they're completely relaxed, just like that, and bend it to about 30 degrees. And you put one hand right here on the femur, on the lateral side of the femur, and you take your other hand, this is your testing hand, this is the hand that's going to move up. You take it and you find the tibial tuberosity, it's a bony prominence on the tibia, and you just pull slightly like this. And you'll feel for that anterior translation. And a modified way to do this, if you have a bigger athlete, football, linebackers, you take your knee and you put it underneath, you put it underneath their leg. You put your supporting hand right here on top and just pull forward. Just like that. Another test for the ACL is the anterior drawer test. So what you want to do with this test, you want to bend the knee to 90 degrees, take one hand, put it on the medial side, and place your thumb on the joint line, and then take the other hand and again put it on the lateral side and put the thumb along the joint line. So both thumbs should be on the joint line, and you want to feel back here with your index fingers and make sure that they're completely relaxed, because if the hamstrings are tight, that could give you a false negative because it'll tense up and it won't allow for that anterior translation. So you just pull slowly, just like that. Okay. This next tape job is for the ACL. I'm going to do it with kinesio tape. So kinesio tape has a little bit more give. It's used a lot by professional athletes, and the way I like to describe it is it's like tacking on, you know, an extra ligament or tendon. That's how it's meant to be. How well it works is questionable, and it's still being studied. So you want to start off with a smaller strip. So these are strips that I've pre-cut. You have one small strip and two longer strips. This strip is going to go here under her patella. So you want to take it and just rip the edges of the back covering, just like that. And you want to start here, right underneath her patella. So normally I would spray Tough Skin, you know, the tape adherent, but since this is just for practice, I'm not gonna put the Tough Skin on this just for show right now. So you want to rub it because the heat activates the adhesive and it helps it stick better. And then you want to take this middle strip and just, oops, pull it off, and you want to stretch it just slightly, probably like a 50% stretch, and then lay the rest on there so it kind of looks like a U. And you take this and just rub it so it helps stick better. So just rub it so it sticks and it's kind of slightly U'd like this. Then you want to take your long strip and you're going to start it this way. So again, probably like, you know, an inch off the ends you want to leave. You don't want to stretch those so that this helps the tape stick. So start it right here in the center and slowly peel that middle piece. And you wanna, I wanna say about a 75% stretch up this way and around. And that last inch, you just wanna lay down like that. And so take it and rub it so that the adhesive activates with the heat. And then we take the other strip. So we're going to do the same thing, except this way we're going to go, with this one we're going to go this way. So lay that down. And again, about a 75% stretch. And around. And lay it on there. Okay, so this is one of the more common kinesio tapes for the ACL, and this tape job should last about 3 or 4 days. She can shower, and you know, as long as she doesn't scrub it, she can shower, and she can pat it down. And we usually recommend that they don't take it off, just wait for it to fall off. Is when it starts peeling off and it's not sticking very well, that's when she can take it off. But this tape job will last a couple days, and that's the good thing about kinesio tape.
Here are some of the ways to help treat and prevent ACL injuries. So a form of conservative treatment would be RICES, which stands for rest, ice, compression, elevation, and support. This is, you know, very, like I said, conservative, very general form of treatment. The more common form of treatment would be cervical intervention. Usually the ACL does require reconstruction because of the limited amount of blood flow to the area. So the ACL doesn't grow back on its own. And two of the forms of ACL repairs would be an autograft, which is a replacement of the tissues harvested from the individual's own body, or an allograft. It's a replacement of the tissues taken from a cadaver. And prevention would be proper education of landing and jumping mechanics, and also using a brace to prevent re-injury. Another knee injury is the MCL sprain, which is caused by tensile forces, most commonly a valgus stress caused by a blow to the lateral aspect of the knee. A non-contact MCL injury is caused by valgus loading or a rotational force being placed on the knee. The test used for MCL sprains is the valgus stress test. To perform the valgus stress test, you want to have the athlete lying supine with their leg close to the edge of the table, and you want to stand on the lateral side of the patient. One hand supports the distal end of the tibia, and the other supports the lateral joint line of the knee. So first, you want to place the athlete in full extension at the knee and apply a valgus force. Then you want to place the knee at 20 degrees of flexion and apply a valgus force. This helps open up that joint a little bit and allows for a more accurate test. A positive finding would be increased laxity in the joint and also pain.
This test is a valgus stress test. It tests the integrity of the medial collateral ligament. The medial collateral ligament is a ligament that prevents valgus force in the knee. So if you get an outside force coming this way and striking you this way, it prevents that movement going in this way. So you want to take your right hand, and you want to put it right here on her ankle. You want to take the other hand and support the knee, and you just want to, first you're going to do it at 0 degrees, and you want to put, so I'm pushing with my left hand, and I'm putting a valgus force on that knee. Then you want to take it and bend it to about 20 degrees, because it opens up the joint more, and you want to bend it that way. So this tape job right here is for the medial collateral ligament. This just helps give a little bit more stability to that MCL joint. You want to tape at an angle like this, and then you take your stretch tape this is Powerflex. You can use Elasticon, works better. It just depends on what you have. So you take it and you start at an angle over here on the outside of the leg, the lateral side, little stick. And then you want to come around like such and come back up this way and just go around. And then you would do the X again. I'm running out of tape. So you wanna make this X design about 3 times, and this will provide a little bit of stability to that medial side of the leg. And then you just close it off with some more of your white tape. Just like that. And then if you'd like to, you can also cover it up with another tape, a different stretch kind of tape, just so that, when she goes to play or something, it doesn't rub down or it doesn't get in the way, just cover it up.
The LCL sprain results from a blow to the medial knee that places tensile forces on the lateral structure or by internal rotation of the tibia along the femur, and the way to test this injury is through a varus stress test. The varus stress test is a lot like the valgus stress test. The only major differences are hand positioning and where you position yourself. So again, you want to have the athlete lie supine on the table with their leg close to the edge. You want to sit on the table along the medial side of the patient's knee. One hand will support the distal lateral end of the tibia, and the other supports the medial joint line of the knee. First, place the athlete in full extension and apply a varus force. Then place the athlete into 20 degrees of flexion and apply a valgus force. Again, this opens up the knee joint and allows for a more positive test. A positive finding, again, increased laxity at the joint and also pain.
This next test I'm going to do is the varus stress test. This one tests the LCL, that's the ligament on the lateral side. So it's the lateral collateral ligament, and we're just testing the integrity of it. So this is a lot like the valgus test, except we're testing the opposite side. So same thing, you're going to put your hand and support her knee like such, and put your hand on the ankle. So this time I'm sitting on the inside of her so that I can test that ligament. And again, 0 degrees first, and then bend slightly, 20 degrees. Do the same.
The last knee injury we will be discussing will be meniscal injuries. So an acute meniscal tear occurs from rotation and flexion of the knee. This causes impingement of the menisci between the femur and the tibia. A chronic form of meniscal damage is caused by overuse and can happen over time. The most common test for meniscal damage is McMurray's test. To perform the McMurray's test, you want to have the athlete lie supine. You want to stand on the lateral side of the knee. One hand will support the leg while placing the index finger and thumb of the other hand along the joint line. You want to fully flex the athlete's knee while applying a compressive internal and external rotation force on the tibia. A positive finding is crepitus and pain. So these internal and external rotation forces, you want to apply them separately. So first you'll do internal rotation, and then you'll apply external rotation, and you'll see the way this is done later in a video.
This test right here is the McMurray's test, and it's testing for injury to the meniscus. So you have meniscus, so they're layers of cartilage that sit in between your the bones in your leg, in between the femur and the tibia, because they don't sit well, they don't sit perfectly on each other because they don't, the shape of the bones. So we have these discs, and that helps, you know, they're shock absorbent, and they help with movement, and also it's just an extra layer in there for more support and more stability in the knee. So you want to take this hand and put it along the joint line, bring her knee all the way like this, turn the foot out so we can test the lateral meniscus, which is the one over here on the outside where my thumb is, and you want to just grind like this. So a positive finding would be you would hear crepitus, or she would report pain. And then to test the medial one, you turn the foot internally on the same thing. See? She's grimacing a little bit in pain. It could be indicative of a slight meniscal injury. And that is a McMurray's test.
Treatment and prevention of these other knee injuries, again, Rice's surgical intervention if necessary, if the ligaments aren't healing properly on their own. You also want to make sure you focus on strengthening of the musculature around the knee, and also education on proper mechanics. Thank you, class, for watching this lesson plan. I hope you enjoyed it and it was educational. If you have any questions, please bring them with you, as we will be having further discussion on this topic in class. Stay tuned for other videos on the various body parts we will be learning about in class. For your assignment, I want you to do further research on one specific knee injury. Find other special tests, forms of treatment, and even new surgical interventions being used to treat these injuries. Or pick your favorite athlete and come up with a treatment plan for getting them back into the game. Get creative with your ideas. Your assignment will be turned in via video, which is to be published on YouTube for myself and your classmates to watch. Once you have all posted your videos, please comment and give each other feedback on what you think, anything you might have found regarding their topic, or how you might have done things differently. In class, we will be practicing the special tests and tape jobs discussed in the lecture, and any other special tests or tapings you are interested in learning. Please place your comments below, and to ensure you watch this lecture in all its entirety, there will be a surprise pop quiz on the anatomy of the knee in class. Thanks again, and I look forward to seeing your work.